The rain came down hard overnight. By morning, roads and walking paths were underwater. Still, they came. Mothers with their children. At 7 o'clock, a line had already formed outside the health clinic at Makwira village in Malawi. Many had walked for hours to get here, some as far as 28 kilometers. In Malawi, tens of thousands of children are malnourished. Many are severely so. That puts their lives at risk.
They live on the edge, and the wrong person sneezes on them, or the wrong mosquito bites them, or the wrong scoop of water gets into them that's contaminated with rotavirus, and then it's too late.
The front line is in the front yards of these community health clinics. It is here, in these remote villages, that the staff and volunteers have a shot at saving the children.
When they first arrive, they get their weight checked on one of our digital scales, and then from there they go and have their height checked, and the things that we're checking for is that their weight for height is adequate.
If the child is malnourished, the mothers receive chiponde and are taught to treat it as food and medicine, all in one. Chiponde is the local name for a special peanut butter paste that is high in calories, protein, and other nutrients. It's been proven to save the lives of malnourished and sick children in Malawi.
The product itself, the RUTF, the ready-to-use therapeutic food, has been shown to be the most effective treatment. 90+% of severely malnourished kids will improve with that.
Chiponde was developed by Dr. Mark Maneri, a pediatrician at Washington University in St. Louis, Missouri. His Project Peanut Butter makes chiponde at a plant in Blantyre, Malawi, to be distributed from village clinics across the country. In 2010, General Mills began sharing its expertise with Project Peanut Butter as part of the company's Partners in Food Solutions program, linking food projects and businesses in Africa with the talents of employees across the company.
The most important thing that I am happy about General Mills is that they're going to help us. In the production room, they're going to help us streamline our production, make things work better for us.
Almost immediately, General Mills helped Project Peanut Butter save more than $260,000 a year by finding an alternative source for milk powder, which is chiponde's most expensive ingredient. General Mills food scientists and engineers are also working to keep the oil from separating from the paste, designing an easier-to-use package, and adding new food safety processes in the plant.
The enthusiasm, the success, the goodwill, the generosity that I've experienced from the General Mills volunteers so far is just a tremendous asset as we try to move forward in Project Peanut Butter. The beauty of what makes my partnership with General Mills really, something that accelerates is they understand food production, and so they're teaching me about problems that I haven't yet anticipated.
More efficient production means more chiponde, and more chiponde means more children nourished.
I remember previously without chiponde, people were dying, children were dying. They were dying.
My child was sick. She was failing to eat anything. The doctor screened my child, and they said that my child was lacking some nutrients in her body. After coming here, my child was enrolled and received chiponde.
Through skits, song, and dance, she and others are told that chiponde is for their sick child only, that chiponde is medicine.
I was feeding my child only chiponde and water 5 times a day. There's a great change. My child is looking healthy. The edema has gone. She has gained weight.
It's an optimistic thing to see the kids, once they've made it here and been recognized and been screened and get on therapy, in your back of your head that 90% of them are going to do just fine.
Knowing that chiponde works gives hope to what should never be. Children who become so malnourished that they risk dying. But the battle is far from over.
Because you see, babies are still there. We need still chiponde to teach others, because those moms need to be taught. Others are still far away, you see. We have to continue. You can't say tomorrow I'll be okay. No. But I'm hopeful because chiponde is medicine. Yeah.